PT Heart is a pro bono clinic that was founded in January 2012 by students at the University of Michigan Flint. Each week, the clinic is managed and staffed by physical therapy and health education students who are overseen by licensed physical therapists. By gaining a certification in PT Heart's Vital 101 course, students will gain knowledge in taking blood pressure, heart rate, and respiratory rates on patients receiving physical therapy treatment at PT Heart. Students will also gain knowledge in BMI assessment as well as patient care and interaction.
Hello, my name is Brandon Warden.
And I'm Leslie Smith.
I think vitals are very important, especially at PT Heart. One day I was serving as an upstairs manager and it was a busy day at the clinic. We didn't have any intake people downstairs doing intake for the general public that was coming into PT Heart that day. So all of the students were seeing patients and I was up there and a patient came in and was had just like a general appearance of feeling unwell, and she asked for her blood pressure to be taken. So being that I was just kind of working on some management duties, I took the time to grab my blood pressure cuff and I sat her down, kind of let her rest for a second because she just looked unwell. And after assessing her blood pressure, it was probably 200 over, I think, about 110. So to me, that's an alarming value. I know that's above the threshold. So Dr. Leslie Smith, she was the clinician that day, so I brought the issue to her.
Yep, and so I came over and talked to the patient, got a little bit more history about what was going on, and that she hadn't been taking her blood pressure medication because it was inaccessible to her at the time. And she also indicated that she had diabetes. And at that time, a nurse who was actually there to look at the soup kitchen for some furniture or something happened to be walking in, and the patient had a glucometer. And so the nurse that walked in actually took her blood sugar, and it was 509, I think.
Mm-hmm.
Yeah. So at that point, we made a decision to call 911 because we wanted to make sure that the patient got the medical care that she needed, and she agreed. And so we called, and about 10 minutes later, EMS came, and we
updated them on the situation, and they took her out in the parking lot in the EMS vehicle, and I think they carried her to the hospital after that.
Yeah, and I think that this situation really highlights the importance of taking vital signs, especially when people are feeling unwell, as at least a baseline to see how they're doing.
Mm-hmm.
To gain certification, both blood pressure and heart rate intake will be assessed in the simulation lab. The patient will be a dummy who is lying down in a hospital bed. To pass the simulation portion of the test, volunteers must accurately identify patient's heart rate within 5 beats per minute and patient's blood pressure within 2 millimeters of mercury for both systolic and diastolic values. First, have the patient seated with their feet flat on the floor. The patient's arm being tested should be held straight at the level of their heart to achieve the most accurate reading. To begin taking the patient's blood pressure measurement, use a properly sized blood pressure cuff. Don't place the cuff over clothing and make sure to support the patient's arm. Wrap the cuff around the upper arm with the cuff's lower edge 1 inch above the antecubital fossa. Make sure it is snug enough. You should be able to fit 2 fingers under. To find the brachial artery, you can have the patient extend their arm and place the pads of your fingers in the crease of their elbow to feel for the pulse. Make sure the arrows of the cuff are right on or right above the brachial artery. Lightly press the stethoscope over the brachial artery just below the cuff's edges. Rapidly inflate the cuff to 180 millimeters of mercury. Once you get to that number, you can take the valve and slowly release air from the cuff at a rate of 2 to 3 millimeters per second. Listen with the stethoscope and simultaneously observe the sphygmomanometer. The first knocking sound is the subject's systolic pressure. When the knocking sound disappears, that is the diastolic pressure. When you no longer hear sound, open the valve and let all of the air out of the cuff. Remember to ask the patient what their normal blood pressure is. If it is normally high, you may need to inflate the cuff beyond 180 millimeters of mercury in order to gain an accurate reading. Normal blood pressure is a systolic pressure of less than 120 and a diastolic pressure of less than 80. Respiratory rate can be assessed by simply watching for the patient's chest to rise and lower. It is helpful not to let the patient know you are testing for this because they are more likely to alter their breathing rate if they know they are being assessed. Again, count for 30 seconds and multiply the number by 2. Normal adult respiratory rate is between 12 and 18 respirations per minute. Heart rate is easily assessed at the radial artery. To find this area, have the patient's palm facing the ceiling and place the pad of your second and third finger over the lateral side of the patient's wrist. Do not use your thumb, as this could cause you to feel your own pulse instead of the patient's. Count the beats for 30 seconds and multiply the number times 2 to obtain the correct beats per minute. Normal heart rate is between 60 and 100 beats per minute, and anything under or over at rest should be discussed with a medical professional. To assess BMI, first obtain the patient's height and find it on the left side of the scale. Then follow the row to the right until you find the patient's weight. The number at the top of that column will indicate the patient's BMI, and the chart color codes the BMI classifications to make the chart easy to interpret.